just wanted to say hello to all of our participants and our speakers. My name is Sahar Khovat. I'm a Senior Policy Officer with Refugee Council of Australia. And before anything, I wanted to acknowledge that they're traditional custodians of the land on which we all work and live, and recognize their continuing connection to land and community. And I pay my respect to elders past, present, and emerging. Thanks so much for joining this virtual forum, focusing on the experiences of refugee women and women seeking asylum during the COVID-19 pandemic. This event is part of Refugee Council's event and is co-hosted by Refugee Council, Settlement Services International and Harmony Alliance. And I'm delighted to have a fabulous group of women who will be speaking today about their experiences servicing and directing and being on the front line of response to the needs of women who are seeking asylum and who are refugees, as well as women who are part of those communities and are supporting and responding to these issues. And hopefully we will have time to reflect on what are the gaps and how do we move forward, how do we address the priorities, how do we address the, what is the main advocacy priorities moving forward. It's a short panel. We acknowledge there is so much to talk about, and hopefully it will be start of an ongoing conversation about the needs of women generally, and especially highlighted during this pandemic. Just some technical notes. We have turned off everyone's videos and microphones except for our speakers. This is just to make sure that we can all listen to everyone who's speaking. If you do have question, the best thing is you can raise your hand, but the best thing would be to type it in the chat box or in the Q&A. That's even better, because in the Q&A, people have the ability to like or comment a post. So we can look at that at the end of each panel. I will be presenting and facilitating the first panel. I also wanted to let everyone know that we are recording this event, and we will be sending out the recording. If you don't wish to be recorded, just consider that when you are asking questions or moving forward. I will be presenting the first panel, and I'm delighted to have Ingrid, Carolina, Andy, and Joanna. We will start with Ingrid. Before I will introduce all of our panelists on the first panel. Ingrid Koulas is the Program and Research Officer from Settlement Services International. She will be presenting the outcome of a survey that Settlement Services International has done, focusing on the needs of people who have presented to their services around New South Wales to seek emergency relief. We will then have Carolina Gottardo. She's the Director of Jesuit Refugee Service, and she's based in Sydney. She will be focusing on her experience directing the service and responding to the needs of women during this pandemic. We will then move to Andy Jones. Andy is Program and Social Inclusion Officer in Uniting, and she will be talking about her experiences working in Victoria. And we will finish this panel with Joanna Joseph. Joanna is the General Manager of Centre for Asylum Seekers, Refugees and Detainees, and she's based in Perth. And we will end with a short Q&A from the audience at the end of this event. The last 15 minutes, we will dedicate more time for Q&A if you have missed your chance to ask a question. Before any, I don't take much of the time, and I will pass over to Ingrid. Thanks so much, Ingrid, and please share.
Good morning, everyone. Thank you for this opportunity of sharing the results of this important survey we've conducted in SSI. I'm going to share my screen. And so we have conducted this rapid pulse survey, which have lasted, it was open for 24 hours in mid-May. So the results are fresh and new. And the survey was launched and conducted by SSI to assess the hardship situation of temporary migrants who have contacted SSI in the COVID-19 period crisis. I'm going to talk quickly around the context, the purpose of the survey, the approach and methods, and most importantly, the outcomes and results, and some conclusions. You can find a summary of this survey in our website in the news section. Is a brief summary, very easy to read and quick. So the context we've been conducting this survey is that around 600 people have contacted SSI services in the COVID-19 crisis period. So talking about 2-3 months, which is a very high number. As temporary migrant visa holders, they have no support from the government in terms of income support or emergency relief, as we know in New South Wales. So SSI has reacted by opening an office a couple of times a week to support with food packages and some donation campaigns. But we needed to do more to collect some evidence based on what we were hearing every day from the people contacting the services. So we've carried out this anonymous survey among the people who have contacted us. The purpose was, in general, as I said already, and it's been said in the presentation, to support and advocate, as is the aim of SSI in general, for vulnerable temporary visa holders and in general for vulnerable communities, and respond effectively to what we were hearing every day by collecting evidence to share with stakeholders from government agencies and NGO organizations. The approach was to reach people that we were in contact with already, and using self-reporting measures. So it was a self-reporting measures taken from well-known surveys conducted among the general populations and refugee population residing in Australia. So we've taken some of the metrics from the HILDA research promoted by the Department of Social Services and BNLA, Building New Life in Australia, which is a longitudinal study among refugees with permanent residency in Australia. And I believe the strength of this very quick survey was to be able to compare the results we have with these important surveys conducted, some yearly and some every 2 years by other agencies in Australia. We had contacted around 2,000 people. We don't have a gender distribution of the respondents because it was anonymous, but we have a gender distribution of who we've contacted, which could reflect very well, given the high response rate, the respondents' distribution. So we have around 20% of women who have contacted SSI for some support, and 80% of males. We're talking about families, we're talking about couples, we're talking about people who was seeking support. 461 have responded and they were on temporary visa, temporary protection visas or bridging visa holders. 80% of them have lived in Australia for over 2 years, with 38% for more than 5 years. So is a population that have been in Australia quite a while. Some results, we distributed the 8 metrics we have collected in a way we think the most hard, they show the most hard and less hard, if that could be a definition. So 62% of our respondents have declared they couldn't put meals on the table, compared to 9% and 3% of respondents in a normal condition outside a health emergency as from BNLA and HILDA. 75% could not pay rent or mortgage. 46% compared to 24, and 3 were not able to heat the house. 1/3 have sought some support from organizations like SSI or others, and some 80% had to borrow money from friends and families, compared to 7 or 4% of the other surveys. These 3 measures don't have comparison with general surveys on Australian population, but they're pretty significant. 80% of our respondents have lost their job, and 50% could not access health services or pay for medication they usually need to take. Some implication of these studies, important ones: not all types of this financial hardship are equal, but we want to underline that not having money to put food on the table is a proxy of very severe financial hardship, and not be able to pay rent, it can be a significant high risk of homelessness. If we combine these measures together, we know that most of the respondents have multiple, and they are facing multiple financial stressors at the same time. So family, households are presenting multiple financial stressors at this time of the COVID-19 crisis. Women, men, children. Conclusions: some of New South Wales' most vulnerable residents are falling into poverty, unable to pay their rent or put food on the table. They are on temporary visas, so they cannot access any government emergency packaging. But SSI has shared these results with government agencies, as I said at the beginning, non-government stakeholders. And recent news is that New South Wales government in early June has released a package to relieve some of the temporary migrants, and we hope that some of this package goes to this community. So these were the findings of our survey very quickly, and implications are even bigger than what we just listed here. So the situation is presented and has resulted as very severe, as I would say. Thank you.
Thank you so much, Ingrid. Very sobering results, and thanks a lot for presenting that. I think it shows a very small glimpse into how the situation is across the country. And these are just people who are asking for help from organizations. We know there are a lot of people who ask for help from the community organizations or smaller communities. So thanks a lot for that. I will now invite Carolina to share your reflections and your observation about what's happening in New South Wales as someone who is directing a non-for-profit and a charity organization that is responding and is at the front line of services.
Thank you, Sahar, and thank you to RCOA, SSI, and Harmony Alliance for inviting us to participate in this very important event. And good morning to good afternoon to everyone. Actually, for JRS and for the services here in New South Wales, the reflection of what SSI just exposed is it kind of we are seeing that every day. So what we have seen is that COVID has had it really has had devastating effects, and that is an accurate word. And I would say also that it has had disproportionate effects on asylum-seeking women and migrant women in vulnerable situations, specifically on women. At the same time, women have also shown the amazing resilience and agency and drive that characterizes them through this crisis. So we have seen that side and then the other side. For us at JRS, and similar to other services, we have seen a 224% increase in demand for our services during this time, which is it's a very telling number, and it reflects what was exposed before by Ingrid. We have a women-only safe space in Western Sydney through our Finding Safety project, and this focuses specifically on women seeking asylum, survivors, or at risk of sexual and gender-based violence. And that way we have been monitoring the effect on women. So my presentation is focusing mainly only on women specifically, and we have seen 4 different trends. The first one is an increased risk of sexual and gender-based violence and increased referrals. And this is because women have been trapped with perpetrators on a 24/7 basis, and they are unable to access services. It was hard to access services before COVID, and now it's much harder. So I want to specifically highlight the situation of the women that are trapped and unable to do anything about it. And a very sad example is what happened recently with the death of Kamaljit Sidhu, an international student in Sydney who was victim of DV. And this is really a harsh reminder for us all of the life and death implications of this situation and what social distancing COVID is really causing, and the importance of a network and support and services. Secondly, is the purposeful exclusion of people seeking asylum and migrants in vulnerable situations from all safety nets and mainstream services and support packages from the federal government. And this is affecting everyone, again, women and girls very specifically, because they are falling to the cracks. And if you add to that the situation of violence that I explained before and situations of food insecurity, that will be my next point, they are in a very specific condition, and many have been forced to stay with the perpetrator because of lack of choice. So we know that the New South Wales government recently has put a pack to support people seeking asylum, which is very much welcome. This shouldn't have been done by this is great from the state government, but it should have been done by the state government, and it's not enough given the scale of the problem. Third is poverty and food insecurity. So we have, Ingrid said very clearly, people cannot secure enough food, people cannot buy basic medicines, people are at danger of homelessness. And here at JRS, we are, for instance, providing pre-packed food to 750 people per week on a weekly basis. And basically what this is meaning, we are seeing many households that are headed by women, and we're also aware of other households where we know there is a domestic violence situation, and we have special protocols in terms of managing that, but we know those women are facing that right now. And are also in need of food, and where many have lost their jobs, either the man or the woman. So this just kind of enhances the very difficult situation. So what COVID has done really is that it has just created a new layer of discrimination in what was already a quite difficult situation. And it's creating a massive gap in between those who are citizens and permanent residents and those who are not. There was a gap. This gap is enhanced. And NGOs like JRS and others, we are doing our best, but we are an NGO, and we are only a band-aid. And it really shouldn't be the responsibility it should be a responsibility of the federal government again. The last one is the issue of overrepresentation in the informal markets, in the informal sector. So basically, refugees and asylum, migrants and asylum seekers and refugees in general were the first ones to lose the jobs. But that has a gender lens that is very specific, because we already have data showing us that again is disproportionate for women. So women have lost jobs at a more rapid rate than men, coming from the data in Australia. And there is also a lower re-engagement rate. So it's going to take more time to get those jobs. And this is simply related with care responsibility, the care burden, and also with ongoing exclusion and discrimination. So that is another thing that is affecting women very specifically. In terms of what's being done by us and by others and by in general, basically for us, our COVID response at JRS has been gender sensitive, and it has been informed by the women that we are working with. So we have actually scaled up our services in general and adapted many of them. We never close our women's space, meaning that we have always been open for crisis response and emergency appointments for women at risk. We are also providing emergency relief specifically for women at risk, and we are providing dignity kits, which are special packs, again, targeted specifically towards women. We also, during COVID, have just hired a specialist caseworker that is looking at the intersection in between DV and asylum. And we thought that was urgent to do, given the circumstances and what we are seeing. On the advocacy front, I mean, one of the other things is that we're doing a lot of prevention. So we're keeping in touch with the women through WhatsApp groups and through different webinars about rights and prevention, and kind of making sure that information is there and making sure they feel accompanied through this period, which is so hard. On the advocacy front, you will be aware what is happening in New South Wales. So basically there has been an emergency pack, and part of that is targeted to asylum seekers in general. So we're talking about 1.5 million. And also there has been another emergency pack for domestic violence services that is not targeted to this sort of population, but is for frontline DV services in New South Wales. And we're talking about 9 million, and then extra money for refuge and a safe house in Manly, etc. But this is not for specifically for asylum seekers or temporary visa holders. We continue working with the National Advisory Group on Women on Temporary Visas, and that has done a lot of work on this. We're part of the RCOA Nobody Left Behind campaign, and in a lot of the different states kind of advocacy efforts. And just to finalize, I would like to kind of finish the way I started, and it's by emphasizing that women themselves are agents, and that they need to be supported as leaders during this period. They have been done amazingly in terms of dealing with what is a huge crisis. And we have also seen a lot of examples of courage, solidarity, and resilience. And the priority needs to be really the response to women at risk, women and girls at risk, and a safety net that doesn't discriminate on the grounds of status. So thank you so much again.
Thanks so much, Carolina. Thank you. I'm now going to invite Andy to join and talk about the situation in Victoria and your reflections and observations about the needs and advocacy.
Thank you. Hello, good afternoon. I'd like to thank Refugee Council, Harmony Alliance and SSI for inviting me to speak this afternoon, and I'd like to acknowledge traditional custodians of the land on which I present to you from today, the Wurundjeri people, and would like to acknowledge elders past, present and emerging. For those of you who are unfamiliar with the Uniting Victoria Tasmania, we work across both states with a number of different community services across the both of them. However, we only have 2 unfunded programs that work specifically with people seeking asylum, and I'm the program manager for those 2 programs. We're based in a northern city suburb of Brunswick, and they're both fairly close together, so they work very close together. But through the Asylum Seeker Welcome Centre specifically, we have 2 programs that concentrate on women. We have a women's weekly English language class, as well as having a monthly women's group. And neither of these programs actually contain a case management component. However, we have about 120 women who engage with both of these programs on a regular basis. And we've noticed that during this time, the need for additional formal supports has actually increased. So both of those programs, the staff and the volunteers who engage in those programs have started to provide some more formalised support to the women who engage in those programs. And because we can't meet physically anymore, we're having to, like a lot of other people, obviously change the way in which we engage women in those programs and keep engaged with them. So we have had to reduce our contact to phone and email. And one of the reasons why it's only been those 2 avenues and not, I suppose, more stuff online is because a lot of the women we've been working with, we've found that they just don't have the resources to get online. So a lot of the virtual sessions are inaccessible to them. So we've found that people either don't have a relevant device, they don't have enough data, or there's not enough digital literacy in order to be able to facilitate sessions. And especially with the the group coming together for a social basis, we found it really challenging to have multiple participants online with multiple interpreters, and we just can't seem to get our head around how to do that at this point in time. So it has been very individual in terms of the assistance we've been able to provide at the moment. So some of the issues that we're seeing more and more come up by some of the participants have been around, aren't new issues, I suppose, but they've been highlighted, I think, much like Carolina was saying and Ingrid earlier. One of the biggest things for us has been parents really feeling scared and uncertain about how to parent during this time. So we've had an increased number of referrals to family support services. And it's not about not being able to parent, is how do I now parent during this time? And a lot of mothers have expressed concern and distress around, and the conflict between, do I send my kids to school and potentially expose them to COVID-19, or do I keep them home and I'm not confident with my level of English or my level of digital literacy in order to assist them with their schoolwork? So those are some of the things that the workers and the volunteers have been assisting mothers with. There's also, I think, as Carolina pointed out before, the increased safety issues. So for women who are living in violent and unsafe relationships, not being able to get out, not being able to have those outlets and have more personal conversations with support services, that's been quite a concern for us during this time. And then the increased amount of people who have lost their jobs and that job insecurity. I feel that all of what Carolina said is definitely applicable here in Victoria as well, especially around the jobs and first out, last back in, and there have been, we've had some anecdotal comments from consumers saying, my employer won't rehire me because they're prioritising Aussies. So that's been quite disheartening and really hard and challenging to deal with. We've seen an increase of people needing assistance with rent and covering utilities. We're lucky enough in terms of Uniting that we have a number of programs that do assist with those issues, but it does come down to not having safety nets. It's all very well and good reducing your rent or putting your rent on hold, but what happens once we're out of the COVID initial pandemic crisis and we go back to a normal state? Yes, evictions are on hold at this point in time, but are we going to see a rush of evictions between September and January? So we're quite concerned about that. So we've been making a lot more referrals to tenancy and advocacy programs as well. We are in receipt of some financial assistance from state government for housing assistance funds. So we are trying to prevent people getting too far in arrears, but we just don't have enough money. Obviously it comes down to money. We don't have enough money in order to make sure that everyone's rent is paid ongoing. We're seeing a lot more incidences of shame as well, and people feeling a loss of pride and dignity during this time, because a lot of the people who are new to our centre we've never seen before, because they've been independent, they've been working and supporting themselves, and now to have to ask for money for rent or for food or for nappies or formula for their babies is really difficult for a lot of people. So with Victoria, my understanding is that similar to New South Wales, there has been some money allocated to people on temporary visas, and this also includes people who are seeking asylum. We've also seen targeted money go towards family violence programs and programs that work with children specifically, along with asylum seeker specific agencies. However, we haven't really seen money for women who are mothers, so don't have children, or don't have children in their care, and we haven't seen money for women who aren't in violent relationships. So when the money has gone to asylum seekers specific agencies, obviously they're quite large and cover a huge amount of people. So it may or may not be directed towards women. I think for us, we'd like to see a little bit more in that space. And I think we're about one of 4 community type programs for women specifically in Victoria. But we're all quite small. We are all sort of in the northwest region of metropolitan Melbourne. And so I think funding groups like ours and the Northern Legal Centre and Salvos and the Broadmeadows Women's House would be fantastic to see a little bit more money go towards providing basic needs, really, because once again, yeah, it comes back to not having that safety net for people and not being eligible for those safety nets. Yes, thank you
so much. And you definitely initiated a lot of conversation and resonated with a lot of people who were listening. So thanks so much, Andy. And last but not least, Joanna, I will hand over to you to talk about what's happening in WA and your reflections and observations. Thank you.
Good morning, everyone, and it is still morning here in Western Australia. So thank you so much to the other panellists for all that you've shared, and what I hope to do is just share the West Australian perspective and also build in a few other issues we've noticed specifically here. So CARAD is a small not-for-profit here in Western Australia. We provide welfare and advocacy to people seeking asylum who don't have any income, so they're not eligible for the SRSS program and are not earning enough money through employment to be supporting themselves and their families. Similar to the other services, we've seen a huge swell in demand immediately and had double the number of referrals and a correspondingly double the spend in emergency relief, particularly during the COVID-19 months. WA is sometimes called wait a while state, and we are the only state, our territory, one of the only who don't have a financial assistance package available specifically for temporary visa holders. And this is hugely concerning because charities here are stretched already, and now people seeking asylum are also competing with other temporary visa holders and Australian citizens for extra emergency relief, and there just isn't enough to go around. So we are seeing people present to our service who are at crisis point, becoming homeless because the rental relief packages aren't suitable for them if they don't have a formal lease. They were already in significant arrears before the moratorium on evictions. And even accessing crisis accommodation is practically very challenging when people don't necessarily have ID. So we're finding just the casework component of our work is also massive as we're helping people try to navigate these ER systems that are really, really stretched. We're also finding that for female mothers and female-headed households, sometimes the dads are trying to hold on to any type of work. We have people obviously employed in the resources sector here in Western Australia, so they might be away at work, leaving a lot of the legwork for things to the mums. So they're still needing to meet visa deadlines. We've had people needing to apply for federal circuit court hearings within the allocated time period, but now remotely with kids in tow, not being able to do things online and remotely. So again, there are so many practical considerations that go beyond just the monetary needs of people seeking asylum in this time. Mm-hmm. We mentioned here as well the educational challenges for families. So a lot of the families with kids at home, we're noticing a huge amount of stress and pressure on the parents to parent and also support the education, particularly when they might not have the technology at home to support that. But one issue I really wanted to touch on as well is detention. So we have a large detention visiting program at CARAD. We have about 40 volunteers who usually visit the Yongah Hill Immigration Detention Centre and also the Perth Immigration Detention Centre. Now, all the detention centres nationally have had face-to-face visiting suspended since early March. There are sort of some one-on-one non-contact visits permitted, but the centre at Yongah Hill has 342 people. So they didn't increase the capacity or the visiting hours, and so essentially it's impossible for us to visit during this period. The centre is also an hour-and-a-half drive from Perth. We have not had any indications that they're reopening face-to-face visits anytime soon. The last we heard was maybe 1 to 3 months. So if that bears out, people will have been separated for 6 months without a face-to-face visit. And there is extreme anxieties in the detention centres about the potential spread of COVID-19. Now, WA has been very lucky about controlling the spread, but there are transfers happening between the centres, which seems ludicrous when we have a vulnerable population. So we have immense concerns there about the vulnerability of catching and containing the spread when social distancing can't be properly managed. But also to note is that the Department of Home Affairs is currently trying to push through the migration amendment about prohibiting items in immigration detention facilities, one of which is phones. Now, when we've got people who've had months without face-to-face visits, a smartphone is the only real lifeline to their families, not only in Australia or their friends or their legal supports or community supports, but their family back home. Now, since I think it was 2017 when the laws changed to enable smartphones, we've actually distributed 150 of them so far to centres in WA and interstate. We have attempted to give everybody seeking asylum access to a phone. But this legislation would give them wide powers to remove that phone if they can show that it's been used inappropriately. But we already know that the oversight is severely lacking in immigration detention. So removing those phones would be removing one of the only lifelines people have during this time to their families in the community. So those are major issues. What I think has emerged as things to give us hope during this time that we've noted at CARAD are a few things. Firstly, it's the mutual support in the community. It has been really heartening to us to see a lot of neighbours calling our service to link people seeking asylum with us. So for a lot of people seeking asylum that might not have accessed welfare services until now, but now need to because they've lost their job, or maybe the person who was giving them free rent has lost their job, they're helping them to connect with us and helping them send documents and navigate through some of these processes. So that's something we really want to highlight and encourage is that, and also the mutual assistance between our people seeking asylum that we support. So we also have women's groups and other groups, and we've noticed them just helping each other out. And that's again something we really want to foster and highlight during this time. We have a huge number of volunteers who do the educational support in the community. And while they haven't necessarily been able to help as practically during this time because of face-to-face restrictions, having the number of somebody to call just to help with everyday concerns has been really helpful for the mental health, I think, of our people seeking asylum, knowing that, again, they've just got a connection and a lifeline to those supports. Our office has been flooded with food donations and toilet paper at a time when it was really hard to get those, and also financial donations. So there is significant goodwill in the community to support people seeking asylum in recognition of the fact that they're missing this safety net. So going forward, I think we want to foster what we hope is a sense of empathy that might have been ignited by the community that have had this tiniest glimpse of scarcity, of separation from loved ones, of financial insecurity, and build on that to show that it is not okay to leave people behind, including people seeking asylum. So we hope that that would be something that gives us a little bit of hope going forward. Thanks so much.
Thank you. Thanks a lot, Joanna. And it's really good to hear reports about what's happening in detention. That's a really important part. And yeah, definitely the recent developments is quite a worry. I know we have run out of time, but Sana, who's going to facilitate the next panel, has generously given me 5 minutes. So what I will do is, there are a few questions. I will choose 2 for now, and then we will leave the rest for the end of today's event. The first one is to Andy, and it's more around it's from Kat O'Neill, and it's from digital literacy that you mentioned. So Kat is saying that access to devices and data is obviously an ongoing barrier to engaging with women at this time. And what are some of the things people are doing to address this?
Yeah, so we've been working with some of the schools. So with some of the women that we may have more contact with, we've been trying to work in with some of the children's schools to see if there's devices that could go home, and advocating more broadly in that perspective. And we also, there was a small grant through the local council that we applied for specifically for SIM cards in order to help people with additional data. And we have worked in with some of the broader uniting programs, looking at making sure that when they're putting in their applications or their grant applications, or asking business partners or business partners approaching us saying, what do we need? Making sure that the consumers in our group also getting represented in those asks. So we have been able to address some of those needs, but I think yeah, it's a lot broader than we anticipated that it would be.
Great, thank you. And then final question is perhaps both to Ingrid and Carolina, because it's specifically about New South Wales. Ingrid, in terms of the survey, it was just a question around whether or not it was focusing on temporary visa holders. And also the other question is around what do you know about the dissemination of New South Wales government's funding, and how is it going to be administered, and all of that. Yeah, and whether or not it's going to affect and focus also on women who have experienced domestic and family violence.
Okay, in terms of the survey, yeah, the answer is yes. It's been surveying just temporary migrants. So we've selected the results around temporary migrants, and in New South Wales. So is people who have contacted SSI, which delivers the services in New South Wales. In terms of the relief package for temporary migrants, what we know is that the government is going to distribute the fundings, $6 million to the organizations in the state to relieve around basically food and medicines, I think, so health. But there is no news, as far as I know, in terms of how the distribution will happen yet. So I'm less aware of this. As I've seen my colleague Astrid Perry, she's asked how. So we are both in SSI and we don't know yet how precisely we're going to have these distributed.
Yeah. Carolina, is there anything else about the funding that you would like to add?
It's 6 million. It's 2 million that is directly ring-fenced to people seeking asylum. Well, 1.5 and then 500,000 for organizations, and then it's that will be through this financial year, and then there is 4 million for the next financial year that hasn't been They haven't said just yet how that's going to be operating. So that's the detail we know, and that's the specific funding for asylum. And as I mentioned before, there is also funding for frontline services on providing frontline support on domestic violence, but that's not targeted specifically to this population.
Great.
That's 9 million.
Thank you so much. Thanks a lot. I will leave a few other questions for the end of today, and I will hand over to Sana to go through this, facilitating the second panel. Thanks, Sana.
Thank you, Sahar, and lovely discussion, everyone else. I would like to welcome the second panel, which includes Tina Dixon from chair. Tina is the chair of Forcibly Displaced People's Network from Canberra. She's based in Canberra. And then we also have Nibras Rabe. Nibras is an Assyrian woman originally from Iraq. And we have Eunice on the call. She's an asylum seeker from Nigeria. What I will do is I will let you introduce yourselves for about a minute, and then share your reflections and your experiences about how refugee women are responding to the COVID crisis across Australia. How about we start with you, Tina, and then we can go on to Nibras and then Eunice.
Thanks,
Sorry,
Sana.
We also
Can you
have
hear me well? Sorry, my connection today is a bit bad.
We can hear you well, Tina.
Thank you. I'd like to thank you for inviting me to be on a panel, and I'd like to acknowledge that I work and live on the lands of Ngunnawal and Ngambri people down in the ACT. I'm the chair of a Forcibly Displaced People Network. We're the first LGBTIQ refugee-led organization in Australia. And during the COVID, we've been particularly busy supporting people really affected in the community. A little bit of a background of what was happening. So the international research data tells us that between 3 and 6% of people from refugee backgrounds would identify as those who are LGBTIQ. And if we think about numbers in Australia, the numbers are going to be pretty high for this group. And yet we see a lot of lack of services for this particular cohort, as well as lack of narratives and conversation about the existence of this group and about particular needs that they may be experiencing. What COVID has showed us that those existing marginalizations and barriers that existed for people in terms of accessing support in Australia were significantly heightened. So for example, if prior to COVID, a lot of people are reluctant to access any refugee or asylum seeker support services because, and in the context for women specifically, there is heteronormativity of services where there are assumptions that you're married to a man, that if you're sick, you know, you may be pregnant. There is fear of discrimination from the services based on pre-arrival context of experiences. There are also fears to be outed to ethnic communities, because still in Australia, lots of people do experience homophobia, biphobia, and transphobia from their ethnic communities. And a lot of people are forced here to choose whether they are openly come out as LGBTIQ, even though they're supposedly in a safe country, or whether they still have to keep it closeted to receive at least some sort of support from their ethnic community. During the COVID time, we've also heard that because a lot of refugee and asylum seeking services were really inundated with requests, many people would turn away. We, again, same, you know, what Ingrid was saying and Carolina, we've seen the job losses. We've seen a lot of people not being able to meet their rental payments. We have quite a few transgender women who are seeking asylum, who either need to have an access to hormone therapy or some chronic illnesses. Some of them do not have Medicare rights. And so with, you know, compounded by the income losses, lots of people were unable to meet those healthcare needs. We had some reports of LGBTIQ plus people more broadly being stuck in households that were potentially homophobic and transphobic, and during requirements to self-isolate or quarantine, there was no places for them to go to have the reprieve from those potentially violent situations. Most importantly, overall, a lot of people reported that there was no support from the ethnic refugee communities. There is big fear to disclose who you are. They cannot access any family support, you know, financials or anything like that, because very often those ones are also people who are persecute them, or simply who they are. And we've seen no targeted information or no acknowledgement that this particular group exists, either from refugee services or from LGBTIQ services. So for example, any analysis that were published on COVID government measures or on vulnerabilities on both sides would not acknowledge that those experiences of displacement that have the components of gender identity, sexuality, migration status, visa barriers, you know, on both sides were never acknowledged, and people again felt invisible and silenced and unable to, you know, to reach out to anyone else. So Possibly Displaced People Network has been doing some crowdfunding, and in April and May, we were supporting those LGBTIQ people seeking asylum who did not receive any other support from any other services. The biggest income for us was rent. The expense for them was rent, followed by some grocery vouchers and also medical expenses. So a lot of people were coming to us to make sure that they could still afford the same medication and the same healthcare as they were able to afford prior to the pandemic, because they still could have some sort of open employment. We were also providing those peer-led spaces. Possibly Displaced People Network is led by all women, even though we work for the whole of the LGBTQ community, but all our board are women, and 3 out of 4 are those who've experienced LGBTQ forced displacement. And we were providing those spaces for other LGBTQ asylum seeking refugee women to meet via Zoom and to discuss and, you know, to be in the same spaces where people share their experiences and to be visible. We've encountered the challenge that lots of people, and, you know, this was said today, either did not have access to appropriate technology or enough phone credits and data packages to be able to engage in the same way. Because we've seen from, for example, LGBTIQ sector, there was lots of events that moved online without recognition, and many people just had no physical capacity, or they were in households where they could not join LGBTIQ events openly because that would out them to their family members and put them further at risk. And I think for us, the main thing was to keep raising visibility of the issue, because very often in pandemics like this or any public health crises, is those people who had already pre-existing marginalization and barriers to various support are going to suffer the most, because all of that gets so much more heightened. I'm going to stop at that.
Thank you so much for that, Tina. Can I please ask, I don't see Nibras here, so I'll hand over to you, Eunice, to share your experiences, and then we can have Nibras join the conversation later.
Hi everyone, I'll just have introduced myself briefly. Okay, my name is Nibras Rabi, and I'm a Syrian woman. I have came to Australia with my family. We left the country fearing from war and conflicts. My family wanted to live and search for the country where we have a bright future, have a freedom of speech, the country that gives us the human rights and freedom, free of discrimination. The only thing we took with us is small memories of peace, which is like the safety and peace were our ultimate goal to achieve as soon as we were settled. As an a Syrian refugee woman background, I do believe that women and girls are the most vulnerable during this time due to the pressure of staying home. I do believe the woman takes multiple roles, responsibilities, and tasks, such as having multiple titles, that is, a housewife who makes sure that everything around the family is complete and ready, a mother who is caring and supporting her family, a teacher who makes sure that her children's homework complete and done while staying home. She is also a carer who cares for the safety of her children and her family. and might also be caring for the elderly or sick parents or disabled siblings. They are also facing frustration, struggle, that is a loss of job, mental trauma that has increased. Refugee women and girls who are in a country with an uncertain status or certain status are particularly at risk because they are often without traditional means of protection, have a very little power, and in settings where there may be a little regard for human rights. Women and girls could face discrimination, rape, domestic violence, forced marriages, abduction. Even though many of us women have had continuous suffering, but at the same time, we learn to survive and be resilient. We learn to manage our situations ourselves. We realize we are on our own most of the time. Hence, I have joined the Asia Pacific Network of Refugee, which is the only refugee-led network across Asia-wide. We have discovered that COVID-19 has hit all refugees, but definitely it has a bigger hit on refugees, women and girls. The Asia Pacific Network of Refugee is a co-founder by Najiba, who you will hear today as well. APNOR includes representatives of 12 countries, that is Malaysia, Thailand, Indonesia, Bangladesh, Afghanistan, Japan, and Hong Kong. In the short time of establishment, more than 90 refugees-led initiatives across have become members. And our recent work on refugee leadership in COVID-19 response included a fortnightly safety check calls through our national country hubs, producing life-saving information in multi-languages in the form of videos and broadcasts targeting women and children specific materials, held national consultation with the refugees so far in Australia, Iran, Afghanistan, and Indonesia. We also launched a COVID-19 refugee emergency appeal, which we look into your support, our refugee local partners across Asia, and our aim is to reach $100,000. All I can thank you so much for giving me a chance to be part of this conference. Thank you.
Thank you so much, Nibras, for sharing your voice and the voices of the women that you are representing through the Asia Pacific Refugee Network as well. Prudence, I didn't introduce Prudence earlier because I wasn't sure if she was going to be able to join us, and we're really fortunate that you are able to join us today. Prudence Malum is the founder of eRise and moved to Roomba in 2007 after spending years in African refugee camp. Do you want to share a little bit more about yourself, Prudence, and what your reflections on the impact of COVID-19 on refugee women in Australia?
Hi everyone, thank you all so much for having me be part of this session today. Listening to Eunice and all the other speakers, I felt a bit, I don't know what the right word is. I just felt a bit frustrated and overwhelmed in a way that a lot of things are going on and a lot of people, even here in Australia, need as much help as possible. And you know, just a moment of self-reflection. If any of us are in a position of help, then, you know, that's what we should be doing. A little bit about myself. I am originally from Chad. I'm based in Toowoomba, Queensland. I've been living in Australia since 2007 with my family. I run an organization, a not-for-profit organization that works with young people from refugee and migrant backgrounds. We connect them with services, we train them in public speaking, and also run an anti-racism school program that goes out into schools in regional rural areas and educates young people about refugees, migrants, and also touch on the issue of racism and using our stories to bring about awareness and connection and mutual respect among young people across Australia. When COVID-19 hit, it was definitely very devastating for myself and all the young people that I work with and connect with, mainly because December last year, we had, just like everybody else, we had a lot of plans, a lot of goals that we wanted to achieve this year. And but when COVID-19 started, it definitely took a really huge toll because we're no longer able to do the things that we wanted to do. Even our training programs allows young people to stay out of trouble, to find a place where they can connect with other young people, have mentors to guide them, and just give them a safe space, a safe zone where after school hours they can come and be there with us. And those that are not working, they can come and have people help them with their resumes, and just have a community of support. And, you know, having that support system face to face made a huge impact in the lives of the young people that we work with. And because of COVID-19, we couldn't do that anymore. So a lot of us had a lot of time on our hands, and really didn't really know what to do with that much time that we had. And due to the fact that a lot of the young people are working casual jobs, are uni students, most of them have lost their jobs, and having lost their jobs, you know, it really affected their income and being able to afford to pay their rent and being able to afford to pay food. So it was just very, it weighted a lot on me, because I'm the leader, and I'm leading this organization. And with the team of support that we had to find ways to support these young people. Started reaching out to churches that were in a position that, you know, whether they can even give these young people $100 to help them out with the groceries for that fortnight. So it has just been a moment that we didn't prepare ourselves for, and we didn't see it coming. And we just had to find ways to make sure that we still kept on supporting ourselves, even mentally, because, you know, talking about mental health, for example, it's not really a conversation that you have all the time. Coming from myself, an African background, is not something that you just talk about with your parents. It's not an easy conversation to have. So now these young people who are isolating themselves in their room for hours and hours with nothing to do, and coming to us, you know, trying to find some services that were able to provide that service to them, and listening to them, and comforting them and supporting them, and allowing them to feel that, you know, they're not alone in this journey, that a lot of people are going through similar situations, and we'll all get through this moment together. So COVID-19 was definitely not, I don't think it benefited a lot of people at all. And even with other young people that have their own little businesses, it affected them a lot. So it affected a lot of people in general. And we just try to stay connected to our community. We have a very small community in Toowoomba, but a lot of people here were putting up their hands and were helping out as much as they can. So the only reason that we all kind of got through it was because the whole community collectively came together and tried to fill the gap where there was a gap, and try to be as active as possible while not having that face-to-face interaction and just doing it online. One of the biggest challenges was the fact that now parents had to be homeschooling their kids. A lot of these parents, they can't even speak English properly, and they didn't really know how to help their kids with their homework. So organizing Zoom sessions and sitting with the kids through Zoom, and like going back to do year 6 math questions that were even difficult for me. It was definitely challenging, but yeah, so it's just, honestly, there is not one clear answer to say this is what we did and this is what we did, this is what worked, this is what didn't work. We just had to try everything that we could, and what worked and what didn't, and we learned from the things that didn't work to improve ourselves, and to make sure that at the end of the day we are aware of what's happening. We're aware of these young people who are at risk, and making sure that we make them feel that they are being supported, even if it's not that face-to-face connection or help. At least, you know, we were available on the phone, and we were just always available for each other, and, you know, usual check-ins and things like that. So that's what we have been doing. That's what I've been doing. I've been feeling a bit drained and overwhelmed, simply because I felt that a lot of the weight was on people like myself who are supposed to be the leaders or supposed to be there and help. But I realized that, you know, it's okay to ask for help, because I reached out to a lot of people and they're the ones that helped me and made me feel a bit more hopeful during this time. So yeah, that's what worked for me. That's what helped. And
thank you so much, Prudence, for sharing all that. I mean, there are so many things that are heartbreaking and that everyone in your communities, you know, in our communities is struggling with. But then there are these small little rays of hope where people like you are improvising, taking what is there, what is available, and making the best of it, and creating a slightly more positive situation for so many around you as well. So that's really, really important to remember in this time. I'm aware that we are running out of time. We have actually gone 20 minutes over this panel's time. I'm really sorry, Najeeba. But what we might do now is that, because we really haven't received many questions related to this panel, we have received lots of messages of support for Eunice, and lots of messages of appreciation for the work you and your organization are doing, Prudence, and for Nibras as well, and Tina, for highlighting issues specifically related to LGBTQI refugees as well. So we have received lots of messages of support, but I don't really see any questions. So we might hand over to the next panel and then have a discussion at the end of that panel. Thank you.
Thank you very much, Sana. I think it has been great to hear speakers actually sharing their powerful stories. So as some of you might not know, my name is Najeeba, and I'm working within SSI in the International Unit team as Gender Advocate. And once again, I would like to welcome you all to the conference. It's been amazing to hear all of you. We do understand that unfortunately this year, Refugee Week is quite different. We're not able to come together to celebrate this important week due to COVID-19 pandemic. However, yet it has never been so vital to mark this Refugee Week because all across the world we can see symptoms of a broken system. More and more people are becoming displaced as borders are closing, as resettlement pathways are getting suspended. And while the number of people forcibly displaced is keep growing, unfortunately, the political willingness and the political response and the international cooperation is also quite slow and blatantly insufficient. We know that basically without an effective response, without a better coordination and collaboration amongst us, the lives of thousands of refugee women will remain at risk every day. And with that, I actually would like to introduce our next speakers on this panel. We are quite thrilled to have Maria from Harmony Alliance, as well as Jeannie Tan from Works. They will be both sharing with us around how they've been trying to respond to the challenges and the issues that we've heard so far, and how they've been trying to advocate more nationally in supporting refugee women needs and issues. So down to you, Maria, and then Ginny. Thank you.
Najeeba, thank you. It's Maria here, and I am having technological difficulties, so sadly I have to deprive you all of my fantastic smile. So I'm hoping that you don't mind. Look, can everybody hear me okay? I feel like I'm repeating, and I've got my IT person working in the background, but not to be. Look, can I start firstly by also acknowledging that we are on the land, for me, of the country in Victoria. I want to pay my respects as well to the traditional custodians of the land. And, you know, in acknowledging country, I think what we all collectively, given our diverse backgrounds, our diverse pre-arrival experiences, we are at a time in our nation's history where we really do need to move past this empty rhetoric and reflect deeply and genuinely, I think, on our obligations as non-Indigenous people who continue to benefit from the ongoing systemic discrimination of First Nations people in this country. I also want to take the time to thank everybody, particularly those who shared their painful lived experiences with all of us. And for me, just listening is such an important part of what I think the role of Harmony right now is. One of the questions before I get into what do I think the gaps out there might be is that this issue of what do refugee women want perhaps needs to be recharacterised in terms of how do those of us who haven't had the pre-arrival experience that women arriving here as refugees have had, how do we ensure that we use organisations like Harmony, one of 6 national women's alliances across the country, how do we make sure that we enable, empower, and genuinely create opportunities for those women to give voice to what they need, rather than have anybody else without that experience characterise those needs? The Harmony Alliance, and why I think it was such an exciting organisation to emerge, is that it precisely does that. It certainly identifies priority areas as per our funding and our requirements, because we have to. But do you know what I hear being talked about when we have our meetings, when we engage our young women across the country, when we host webinars, is that we hear the need to hold a mirror up to our own organisations and ask questions of representation and voice. Can migrant women who don't have those pre-arrival experiences profess to talk about those issues? And if they don't, how do we ensure that the Harmony Alliance is a proper ally, a genuine ally, and asks the harder questions of ourselves around the representation of these issues? So I would like to say that whilst the Harmony Alliance is a platform for ensuring that the kinds of issues that we're addressing right now are a reflection of what women with that lived experience, with that organisational kind of and political basis are telling us, that our job is not to interrogate that, but to present it in ways that really do end up making a significant difference in terms of outcome. The other thing that I think is important for Harmony to keep reinforcing here is that the way in which those lived experiences have been represented falls short of ensuring that agency and strength of those lived experiences is coming to the fore. That to some extent what we're also hearing is whilst the barriers are significant, and Harmony has really made an effort to make sure that we that there are language issues, that there are issues around visa status, that there are issues of accommodation and welfare, all of the things that we've heard being spoken much better than I could possibly articulate today. And they are very real issues that need to be brought to the fore. But we also need to be making sure that we're creating those opportunities where those issues can be brought to the fore in ways that truly, genuinely represent the voices of those very women themselves. I think the other thing is that we need to be challenging this idea that refugee women don't have that sort of agency, that all we're ever asking them to do is share their vulnerabilities. I think it's time to start really genuinely and moving past the rhetoric of strength-based approach to starting to say there is political agency here. The time is right for us to think about different ways that we can organise around a lot of this stuff. And I really do want to emphasise that. The gendered nature too, if I could say, is something that's missing in the discourse and the dialogue, even now. And I know that one of the conversations, and Sana, you might want to add here, but one of the conversations that we're having at Harmony is around intersectionality and what that genuinely means when we're talking about representing the diversity of perspectives out there. The gendered approach to resettlement is clearly important, but we also want to highlight that to some extent, the primacy of gender also needs to be grounded in a real understanding of intersectionality. And I really, Tina, your sharing of your background and your information around the LGBTIQ experience is exactly what we're talking about. We cannot reduce these experiences to this monocultural, sort of monolithic experience that then speaks to some of the media misrepresentation of how the lives of women and children and men unfold as they embark on that really challenging journey of settlement. Look, can I say, and I hope as the chair of Harmony, I really want to say that we want to alter assumptions, we want to expand the horizons, we want to push boundaries around how this conversation and discussion is happening right now as we enter a sort of, I suppose not post-COVID, but a recovery phase. I think that, to use, if I could, a quote that I heard Marley Silver, a Gamilaroi and Dunghutti storyteller, and in fact the co-founder of Titters, if anybody knows of their great work out there. But I think this is such an important thing to say when you ask me to canvass what's going on out there, what do we need, what are our priorities. I could recount everything that has been so eloquently put today, but I actually want to make this statement as encapsulating exactly what I think we at Harmony have been talking about. And I quote Marley, "While this moment in history is shocking and dark, it might also be the awakening people need. This could truly be the turning point which could lead us to finally challenging the systems which have failed us all. As long as our talk turns to action, listen to voices of colour, step aside for them to be heard, call out casual racism and anyone who questions the validity of the full spectrum of struggles that are out there every single day. Put pressure on those in power to make real change, but be kind. Spread love and hope for a brighter tomorrow, because our children and their children absolutely depend on it." And I think that rather than, as I said earlier, go on about the full range of issues that have already been canvassed, I'd like to instead make a more, I suppose, a wider call for action. And that's three key things. Let's really change this narrative of vulnerability and deficit to one that represents the strength, the incredible agency and resistance of the voices that we've just heard. To secondly, be willing to actually step aside. And I mean that even as a migrant who I could argue 30 years ago was subjected as a Greek Macedonian settler to this country, was subjected to accounts of racism and daily struggles. That no longer applies. And as a white European woman, we do need to shift our narrative to making sure that the voices of those women who are arriving in Australia right now and embarking and confronting those challenges are truly heard. And finally, though, I think collectively it is time to really think about allyship in this country between us all, because the Harmony Alliance represents a vision of solidarity and harmony that is prepared to have the hard questions, but it's also prepared to ask questions about detention, to ask the hard questions about if we are all in this together right now during COVID, and if we are about building community and social cohesion, why are some members of our community missing out? And are we happy to sit back and think that's okay? I don't think we are. And I think, I can't sort of find the quote right now, but I think there's a fabulous quote that Arundhati Roy makes more recently about the sort of post-COVID normal. And in her words, she really, really calls for us to make better use of what this current COVID environment has raised about our inequities and about the injustices. And I'm not sure that we can continue to hide behind the rhetoric without action. Finally, if I could say thank you from the depths of my heart for all the sort of expressions of solidarity and lived experience that I've heard on this forum. We clearly need to have more discussions across our organisations, because in my view, strong, equitable societies have to incorporate a mix of voices, a mix of influences, but those different threads of experience, in my view, make us the diverse range of women that we are. Thank you for the opportunity.
Thank you very much, Maria, for your powerful speaking notes. Now we would like to turn into Ginny, and the floor is yours.
Ginny, I'm from Sister Works. After hearing Maria's speech, I think she should be the last speaker. Her speech is really inspiring and powerful, and now I'm left with nothing to say. And so I just want to thank you for having me here today, and I gratefully acknowledge the Jajawarong people, the land that I'm on, as traditional owners and custodians of the land, and I pay my respect to the elders past and present. I actually had a lot to say, but now I've got nothing to say because a lot of the topics was covered by very inspiring people, and there were some heart stories that were shared by Eunice, Nibras, and Prudence. And so what I'm going to say won't be anything new to anybody here, but it will just be my personal experience. So because it's Refugee Week, I also want to basically, celebrate the beauty, the strength, and the resilience of our migrant women, and the culture, and the food that you bring to us. And we're here today because we hope that in return we can make our migrants feel welcome, feel safe, and continue to thrive. So Ingrid has covered survey income and job losses, and Carolina had covered a safety issue. Andy concentrate on the women about hardware and computer literacy, and they are in a similar situation as us. So we are in Central Victoria, in Bendigo, and we actually only started in mid-January. So we are really, really new. And so what today I'll share is my story. So I'm a hub lead, and we are working to deliver the UN Women's Second Chance Education and Vocational Learning Program, and that's funded by BHP Foundation. The aim of this program is to help women from Indigenous, refugee, displaced, and low-income backgrounds with learning and employment pathways through formal or vocational education and entrepreneurship training. So where we're based is in Bendigo, and Bendigo is a regional town in Victoria. It has got a population of 110,000 people, out of which 15% of Bendigo population is born overseas. So that's about 16,500 people, and a lot of them are Karen and Afghan refugees. So they make up a large portion of this number. So in regional town, working in a regional town, I just realized that it's quite different from working in the city. In regional towns, we have a lot of newly arrived migrants or refugees, which means that they have very little or no English skills. A lot of them haven't learned how to learn. So, and additionally to in a regional town like that, the employment opportunities are much lower as well. So I suppose, we would encounter similar, identical problems, but sometimes it is amplified. So all the housing issues and income problems that have been covered by all the panelists, we see it here and sometimes, amplified. So before COVID, we actually started full-time in a physical space provided by the City of Greater Bendigo Council. And what our programs is to help a refugee, migrant, asylum seeker community in our women to come in to have craft classes embedded with English lessons. So we teach, so there'll be days when we teach them how to paint, we teach them how to sew, we teach crochet, we teach knitting, we teach, processing a wool from a sheep or alpaca and then spinning it. And we basically cover everything, for a lot of reasons, for upskilling, for mental health, for English lessons. So that's what we were doing. So we started in mid-January and COVID hit in March. So we were going really well. We also ran educational activities in partnership with one of our key partners, Bendigo Community Health. And using the skills that I have learned during this time, the sisters were also earning supplementary income by making products to sell in Sisterworks. So Sisterworks is a non-profit social enterprise. And in addition to that, they were, helping to sew and upcycle, repurposing a superseded uniform with a private school, Girton Grammar School, and then sending off these uniforms to the Philippines to be used. So we were doing that for, so it's each month. So we're doing that for 2 months. We're going really well, full, and everyone's really happy. Classes was filled, lots of activities. We're doing that. But once in lockdown, it just really highlighted how much when we are in physical space, we have relied on a lot of non-verbal cues, things like body language, hand signals, eye contact, for our communication with the sisters. So when we lost that physical space, the language barriers experienced by these women were, hugely amplified. And the only way to contact them was by phone using the interpreters. And that take a really, really long time to get through. We can't really send text messages because a lot of women, not just illiterate in English, they were also illiterate in their own language. So it wasn't a very realistic form of communication. Sometimes, these are experience with barriers that come in after COVID-19 to try to maintain the communication and contact with the sisters and to, and maintain that network. A lot of our volunteers are also older generations. They are in a very much vulnerable group when it comes to COVID-19 exposure and chances of getting COVID-19 consequences are pretty more severe. Being from older generations, they also are, like our sisters, they are not that computer literate. They are very good at crafting, so they are able to impart that skill in crafting and providing that mentorship and companionship and connection with our sisters. But once that hit, our volunteer group days fell away. We basically lost our volunteers as well. So our volunteers are now experiencing what our sisters are experiencing as well. The difference between our sisters and the volunteers is that whilst they have lack of computer literacy and not able to maintain contact as much, is that at least have the advantage of a common language to communicate with, and they have ready access to the news and the information to what's going on. They have family support, and they can get help to reconnect online and be linked to family and friends. But that means that pre-COVID, where we once have almost a ratio of 1/3 of volunteers to 2/3 sisters, we've got nothing now to keep in touch with our sisters. There's only Leah and me. So Leah is working 2 days and working 3 days to try to maintain the classes and also maintain the contact with our sisters and maintain the contact with our volunteers. To do that, to try to make up for the shortfall, we basically, have to use SBS translated media to send it out to our sisters with whatever form we can, text messages, WhatsApp. And we also use translated informative flyers and videos in the language that were created by other key services partner in the community, including Bendigo Community Health and Loden Campassi Multicultural Services. And one of the things so we had to paddle quite hard and keep on evolving. And one of the factors that helped us learn how to best navigate this period was constantly communicating and sharing information and resources with our partners in the community, just getting feedback and then tweaking it very quickly and, really fast, and just trying out different things that would work. A fortnight after lockdown commenced, we were ready to begin online workshop delivery to the sisters by video calls. So we're trying to now go online and deliver the same classes that we used to do in a physical space. But the language, barrier that you all talk about and limited technology skills were, obviously our biggest barriers, because many of our sisters only had a phone if they're lucky, and, not many at all have smartphones. They don't own any computers or have a lot of internet data in their home. We talk about struggling with income losses, yes. Finding accommodation and basic food needs, yes. Those are the same problems, so they are, Eunice talk about the pressure and the depression she goes under as a result of all these things. And that's what the sisters are facing. So we don't really, as much as there are basic needs, and in scale of things, our crafting classes seems to be, low down the base of baseline of needs. We still feel that it needed to be maintained because we think that it actually would keep that connection going, and and mental health, and it's actually something to know how the sisters are faring. So now we talk about struggles with having kids at home. So all of a sudden, moms that used to come to our classes, and it is their mom's time, their time to have a social connection with other women in the community, be it their, within the culture or sharing culture or with the wider community. Now that time is taken out with managing kids at home, with housework, with the stress of loss of income, with a lot of people at home. On top of that, there is also this homeschooling issues. How are they going to support those kids? So it is a big struggle for everyone. So we recognize how much pressure there is on the women. So to minimize any further stress for everyone, we thought that maybe what if we send out kids to home? What if we send out coloring books to homes? What if we send out things to home so that they can do it in the time, they can do it the family. So we focus on family oriented things that we can send home, so that they can, as a family, have some kind of relief from the day-to-day pressures. So we did this, and we have to find new ways to do it. We began doing what we call offline classes. We start delivering donated sewing machines into home, created sewing projects, and to do this we need help with translators. And unfortunately, we were very lucky to get a few young translator that is part of the community, and they are fundamental to what we're doing with the offline and home delivery. So so I think, Najiba, you want me to hurry up, don't you? I'll try my best. So for some of the women who were able to access online, very, very few, they were able to get online and, you know, have that, still have that social interaction happening online with the online class. So computers and smartphones, which were not part of the basic necessity, have now become a sudden and unexpected importance of these resources in homeschooling, and it just left, you know, our sisters unprepared and overwhelmed. So even though when the school delivered iPads to the home, the parents are unable to support the kids with, you know, with homeschooling. So this was just one of the areas in which refugee women are significantly disadvantaged, because it's to do with communication. So being unable to catch up with others in the community face-to-face meant that they were no longer able to communicate as effectively, and fear. There's fear because there's not enough information coming into them as well, because not knowing what's going on, how to do it. So for some, that regular face-to-face meetup is a lifeline that links them to the community. So we had to check on the sisters about, you know, how the family is faring, you know, any issues with violence. And when it was in a physical space, that was easier. So out of this experience, I would identify that our refugee women need, you know, besides all the bigger things that they need, they really need a physical space to have regular face-to-face catch up with others in the community in which they live in. And if they don't, it meant that they are no longer able to communicate as effectively, especially in my, you know, experience in my region, in Bendigo, and to link up with that community and immerse in that community. And that's really important, because that community gives them that support. Therefore, if we don't have a sort of women feel safe, physical space, it's for them to communicate. So they need support from the community. So if there's no physical space, one of the key pillars for their needs are not met, and we need to move into virtual space, which, you know, all of us are doing now and doing it relatively easily. But how are we going to do that? Because I don't think so that just during the COVID period, this will stop, this online thing will stop. We would have to move forward and think that this is going to be part of our life. So obviously, you know, one of the things is we need hardware, and that is covered by one of the other speakers as well. We also need hardware, and we need training. We also need to recognize and value and encourage more young people like Prudence from each of the migrant communities to value their roles in taking out leadership roles, because we need them to bridge that gap. We need them as a voice, you know, between intergeneration. We need to provide safe spaces for the communities to learn and grow, be it physical or virtual. That space, that connection is really, really important. So I'll leave it as that.
Thank you very much, Jeannie. That was also a very strong presentation from you. I do understand that we have already reached our mark in terms of the time. So I was going to open up now to probably Rahima and also questions from Kat, but unfortunately, as our time is up, I would really need to bring this event to the closing. And once again, to thank each and every speaker for their time and their contribution to the forum. I think it has been a great forum to hear each and every one of you in terms of what you've been doing with in relation to COVID-19 context. It's also been a great pleasure to work with Harmony Alliance as well as Refugee Council of Australia in hosting this event. We will be putting a report, we'll be producing a report out of this forum, and we will be sharing the report and its findings with each one of you. And for anyone who feels like that they haven't been able to share or to provide comments or questions, please feel free to reach to me or Sahar or Sana from Harmony Alliance, and we'll be more than happy to incorporate those feedbacks or comments within our final report. I think one of the key takeaway message that we heard from Maria is that how do we ensure that we are able to incorporate refugee women voices, their knowledge and experiences in shaping our policies, and also creating real spaces and opportunities for their engagement and preventing tokenized engagement of refugee women. With that, I do understand that we're 2 minutes over, and I'm sure you all are busy. So once again, I thank you all, and we shall distribute the report once ready with each one of you. Sahar and Sana, if you have any final words before we actually end the call.
Just thank to everyone, all of our speakers. A lot of issues you shared were quite personal, and thanks for your openness and your courage, and they give us strength and drive to work in this area and continue what we do. So thank you so much to all of you.
Thank you.
Okay, thank you all. Have a great day.
Thank
Bye.
you.